Welcome to the Explainer. In healthcare, a few little letters can literally mean the difference between life and death. It's this whole world of codes that seems, well, super intimidating, right? But it's all built for one single purpose: perfect clarity when every single second counts.
All right, take a look at this on your screen. Does that mean anything to you? Because it's a super typical note you'd find on a patient's chart. Right now, it probably just looks like a jumble of typos, maybe?
Yeah, it looks like gibberish. I get it, but trust me, this is not random. It's actually a highly efficient system, a kind of shorthand that was developed to save precious time and, more importantly, prevent errors in these really high-stakes situations. And here's the cool part. By the end of this explainer, you're going to be able to read it fluently.
Okay, so here's our game plan, our roadmap to understanding this language. We're going to look at why it even exists. Then we'll decode terms for time and frequency. After that, we'll see how it tells a patient's story and guides what to do next. And finally, we're going to solve that puzzle we started with.
All right, first up, the secret language of care. We're talking about why these codes exist in the first place. I mean, why not just write everything out, right? Well, the answer's pretty simple. In medicine, seconds can make all the difference.
So this whole system is really all about two things: speed and precision. When a nurse or a doctor or a technician sees these abbreviations, they know exactly what's meant, which allows them to act super quickly and accurately. The entire goal here is to streamline care and keep patients safe. That's it. Okay, let's get into it and start decoding some of this stuff. Our first set of codes is all about timing, because believe me, in healthcare, when you do something is often just as important as what you do.
Okay, if there is one term you walk away with today, it has to be this one: stat. When you see or hear stat, it is the universal signal for drop everything you are doing and do this now. It really signifies the absolute highest level of urgency. No questions asked.
And it's not just for emergencies. This system is amazing for organizing routine care. So a prescription won't spell out take twice a day, it'll just say BID. Super simple. And that term PRN, or as needed, that's also totally crucial. It gives caregivers the power to respond to what a patient needs, like for pain medication, but only when it's actually necessary.
And these terms? They're all about fitting medical care into a patient's real life. So, a medication marked AC, that means it needs to be taken on an empty stomach before meals. QHS? That means it's the very last thing you do before you go to sleep. It's all about syncing up the treatment with a person's natural daily rhythms.
Awesome. So we've got the timing down. Now let's look at how these abbreviations are used to quickly, almost instantly, paint a picture of a patient's condition and their history. These terms create a quick snapshot of the patient. A&O tells us they're mentally clear. That's always a good sign. SOB signals a really serious complaint, shortness of breath. You see that? You pay attention. NPO is a critical safety instruction, usually for surgery. It means nothing by mouth. And DX, that's just the simple shorthand for their overall diagnosis.
Okay, this right here is a fantastic cheat code. Seriously, just by knowing these two little prefixes, you can start to understand dozens of different conditions. Hyper means too much of something, right? Like hypertension, high blood pressure. And hypo means not enough, like hypoglycemia, low blood sugar. Simple, but so powerful, right?
And here are some of the real heavy hitters. These acronyms, MI, CVA, UTI, CHF, they represent some of the most common and serious diagnoses you'll ever encounter. They're used so often that they've pretty much become the standard way to talk about these really life-impacting conditions. So we know the timing and the patient's story. Now, how does this language actually direct the healthcare team to act? Let's take a look at the medical action plan.
So medical actions, they generally follow this pretty logical cycle. It all starts with monitoring, gathering data like vital signs. Then based on that data, the team can treat using things like an IV or oxygen. And throughout this whole process, they have to protect everyone with PPE. And finally, they assist the patient with their daily living activities to help them recover. It's this constant flow of information and action, all guided by these little codes.
All right, the moment of truth. It's time. We have gathered all the pieces of the puzzle. Let's circle all the way back to that confusing sentence from the beginning and see if we can finally decode it together.
And here it is again. It probably looks a little less scary now, huh? Let's break it down piece by piece.
Okay, let's start with the first part. PT/SOB. We now know PT is patient, CO means complains of, and SOB is that big one, shortness of breath. Next up, we've got HX of HTN. HX is just shorthand for history, and HTN is a perfect example of that prefix rule we talked about, hypertension, which is of course high blood pressure.
And finally, the command get vs stat. That means get the vital signs, and because of that word stat, it means get them right now.
So putting it all together, what looked like total gibberish at the start becomes this very clear, very urgent message. See? You're basically fluent already.
So here's the crucial takeaway. This language, it isn't about being exclusive or trying to confuse people. It's the exact opposite. It's this universal tool that allows a huge, diverse team of professionals to communicate really complex information with incredible speed and clarity. And that, ultimately, saves time, and it saves lives.
And get this, in just the last few minutes, you've learned the fundamental building blocks, the prefixes, the acronyms, the timing codes that will help you understand well over 100 common medical terms. You're now equipped with the basics to start decoding the language of care.
And all this leaves us with a pretty fascinating question for the future. You know, in a world of advancing AI and all this new technology, how will this essential human shorthand evolve? Will it adapt, or maybe even be replaced entirely? It's definitely something to think about. Thanks for joining us on The Explainer.